More than 700,000 Americans have knee replacement surgery every year to eliminate chronic pain from worn out joints, and doctors say that number will skyrocket over the next decade. Now, as Darren Mullen shows us in tonight's HealthCast, a new two-pronged approach is helping patients get back on their feet faster than ever before.
56-year-old Judy Tactile started struggling to get around almost 7 years ago.
As you're walking, you're scraping bone on bone. Very, very painful.
Judy had one knee replaced. At that time, traditional knee replacement meant inpatient physical therapy and a long recovery.
How is your knee feeling?
So when Judy's other knee started to wear out recently, she was anxious to find a better way. Dr. Nakul Karkare is an orthopedic surgeon who specializes in hips and knees. Dr. Karkare pre-planned surgery using three-dimensional imaging of a patient's knee. Then, during surgery, he uses specialized tools or jigs.
The advantage of using these jigs is that these jigs are customized specifically for the patient.
Surgeons make very precise cuts to remove the diseased part of the bone and then insert the artificial joint.
It is also less invasive because we do a lot less cutting and drilling into the bone. And I think that translates into a little bit better rehabilitation.
Judy was on her feet shortly after surgery and home just a day later.
I feel good.
6 weeks post-surgery, Judy uses a cane only when walking outside on uneven ground. She's looking forward to leaving that behind sometime very soon. Darren Mullen, KFDX 3 News.
The doctor tells patients to expect their new knees to feel great after about 12 weeks of physical therapy. Even with the less invasive customized procedure, the doctor says recovery from knee surgery still takes longer than a hip replacement. For more information, head on over to